Great. Glenn, thank you so much for the kind introduction. I am so excited to be here at this very unique summit that brings together healthcare and economic development. Excited to be back in Mississippi. You have a knack in Mississippi of making outsiders feel welcome. In my dozens of, maybe scores of visits to your state, I've always felt that. So it always makes it an enjoyable experience to come down here. The second reason I was so excited is I was going to have the opportunity to hear Governor Bryant speak. Love hearing him speak, hate being the one on stage after him. I've had the opportunity to meet a few dozen governors in my job as a leader in site selection at Deloitte. You have a really good one here in Mississippi. Governor Bryant, you are one of my favorites. You are a treasure, and thank you for what you do for the state. What is economic development? What are the goals of economic development? Economic development is what? It's all about creating jobs. It's all about improving quality of life, increasing the tax base, and improving income. Those four goals that economic development has. I would suggest to you that healthcare intersects each one of those goals and is an influencer on the outcomes in economic development. In my day at Deloitte, 20 years of being a site selector at the firm, I've had the opportunity to visit over 600 communities. My job is to know communities. My job is to advise my clients on the capability of a community to support what that company needs, whether it's a manufacturing plant, a distribution center, corporate headquarters, R&D center, IT center, contact center. Does the community have what that company needs? And when you specialize in understanding communities, you need to understand what's going on in workforce. You need to understand what's going on in terms of quality of life issues and trends and threats and opportunities. And that's what we're going to talk about a little bit today. Specifically, I'd like to bring up the slide deck if we could. We'll talk a little bit about this scourge that our nation is facing, the opioid epidemic. I'm neither a clinician nor an epidemiologist. I can hardly even pronounce the word. But what I do know is communities, and I do know what companies are looking for. And when you have a crisis, an epidemic like our nation is facing, and a very uneven distribution of outcomes and impacts of this crisis, it becomes an important issue for us to study. The 2017 statistics from the CDC are out. There were 72,000 overdose deaths in the United States last year. Those of you in the healthcare community, you may see it every day. You may know someone that is impacted. You may know a family that is impacted. You may have treated people that have been impacted by this terrible crisis. At 72,000 people every year, that is a greater cause of death than HIV, a greater cause of death than guns and firearms. This is a big problem for us. We all know it's a problem. And what we're going to talk about today is how is this a problem related to economic development? What is the linkage of this crisis to how companies make location decisions? And what can we do about it? So in the next 25 minutes or so, I'm going to first of all spend a few minutes teaching you all how to be a site selection consultant. Who wants to be a site selection consultant? Our governor's got, the first one is to raise his hand. I'll tell you, this man is already a site selection consultant. He's many things. So we're going to talk about this notion of site selection. We're going to set some context so that you can understand why data like the opioid data distribution, why that's important to companies. And then we'll show you some of the data. We'll show you some of the data of Mississippi counties. We'll show you that data as it relates to the national and regional context. And we'll explore how Mississippi is doing. Okay? So site selection, location decisions. When companies make location decisions, if you've ever thought about this, if you've ever wondered why does Conti Tire choose Mississippi? Why does Yokohama Tire choose Mississippi? Why do any of these companies that come here, why do they come here? Well, you know, they have a process. There's a process that they need to follow. And at first it starts with setting objectives. What are we really looking for? What criteria do we need to follow? what's important to us as an organization. A manufacturing plant, a logistics center are going to have very different criteria than a corporate headquarters, right? They're going to care more about utilities and logistics. They'll care more about production labor and engineers. The headquarters is going to care about the airport, the quality of life, high-end executive talent, etc. So you set that criteria first. Then you move through this process of elimination. Site selection, location decisions, job creation projects are much more about site elimination, much more about location elimination. We are looking for any reason to eliminate a state, any reason to eliminate a county or a region or a metropolitan statistical area. We match up what that company's looking for with the data that we pull on communities, and we start eliminating locations. We get down to a handful of locations that we think have what we need. Maybe that's supported by an available site and building. Maybe that's supported by knowledge of a industrial park and utility capacity, depending on the project. And then we spend more time in that community. In the validate stage, this is really getting on the ground. This is interviewing other employers, asking them what their experience is in talent. What shortages are they finding? What's the cost of operating here? How well supported are they by MDA and the government in Mississippi? Are they having any issues with drug overdoses? Are they having any issues with people passing drug tests? Are they having any issues with the opioid crisis? 5 years ago, we weren't asking those questions, and we are now. Ultimately, this culminates, this process, in getting down to 2 or 3 finalist locations. There's a negotiations process for the incentives. Mississippi does very well in that domain as well. And then a final announcement is made, and the company implements. This is the process. This is the process companies go through. On your way to becoming a location consultant, as you all are now. So what's important? You might think, because incentives are what's in the papers when a project is announced, that these projects care only about incentives, and that could not be further from the truth. You really have to start, especially if it's a manufacturing or distribution project, you have to make sure that the logistics solution is well understood. The logistics costs in with these companies is so massive, that will drive the search area. If we can even look in the Southeast, and what states should we look at? Number 2, then you start to look at workforce issues. Looking at risks, understanding utility draws and utility capacities, very important. Eventually we'll think about things like taxes, property tax, corporate tax, franchise tax. We have to find sites. This is site selection. Ultimately, you need a land or building. And then, when you get down to these finalist locations, then you think about incentives. Everybody thinks we start with incentives. We don't. We end with incentives. Incentives are the gravy on top. Incentives will not make a poor location successful or doable. Incentives are simply enablers to help the company get started, get ramped up quickly, and be able to get a greater return on their investment. Reduce some of that upfront cost, equalize high cost and low cost locations. So this is the general process, the general flow. You all feel like you're location consultants, right? Feeling better about that? Okay. Well, this issue of opioids we're going to spend a little time with. There's a number of intersections of the opioid crisis with corporate location decisions. First off, workforce issues. The opioid crisis is hollowing out our blue and white collar workforce in a number of different communities around the US, and we're seeing it. First of all, we're running into it in terms of labor statistics. We're able to see it show up in the last couple of years in terms of unemployment rates, in terms of absenteeism, in terms of turnover. We're able to use opioid statistics, which I will show you shortly, to do what we call screening. Remember that upfront part of the location decision process. After we figured out what the company is looking for, we're using data and analytics desktop to eliminate locations. The opioid data that we now have access to enables us to use that as a screening tool, for better or for worse. And third, workforce impact, due diligence. Due diligence is in the validate phase. That's where we're in the final 3 to 5 communities. And guess what? We're talking to 6 to 10 other employers in that community. I was in Ohio 3 weeks ago doing due diligence for a large bank coming out of New York and Tokyo, looking for a large IT center. And this community in Ohio was in the top 4. We were conducting employer interviews with 8 different financial services organizations and other employers. And one of the stories that we heard was there's a machine shop not far, a couple of communities away from where we were looking. Machine shop wanted to open another shift, put out a job announcement, started receiving applications. They got 200 applications for those jobs. Awesome. They notified all the applicants that they'd have to pass a drug test. 100 of those applicants, more or less, withdrew immediately. The remaining 100 that came in for the drug test, 3 out of 4 failed, leaving the company with 25 applicants who hadn't been interviewed yet. Their only qualification other than their resume was that they were able to pass a drug test. 1 out of 8. 7 out of 8 failed or withdrew. That is the opioid crisis. That is something that we did not hear about 5 years ago. I've been doing this at Deloitte for 20 years, and I worked for another company prior to that. This is a new phenomenon. This is the scourge. That is what we're going to hear about in due diligence. When we come to Mississippi, and we're speaking to employers in Hattiesburg or Biloxi or Starkville or Oxford, what kind of stories are we going to hear? What kind of incidences are those employers going to report? That's what we need to figure out. So workforce is the first and most important area of this intersection of opioid with economic development. Number 2, quality of life. The wake of destruction that this scourge is leaving on communities is immense. We know this. You know this. You know this better than I do in Mississippi, right? Children that have absentee parents, that aren't being brought up the right way, the spiraling downturn of drug addiction has a lot of impacts from a quality of life perspective. And we're starting to see that emerge in terms of crime statistics from the FBI, which we use for screening, right? We've got that now. And then third, municipal budgets. I was in another community in Kentucky about 6 months ago doing due diligence and had a chance to interview the county executive. And he said, this opioid crisis, you should know, is destroying our community. He's telling this to a site selection consultant who has a $500 million, 1,000 job client that I'm looking for the right community for. He said the reason it's destroying our community, yes, all the workforce issues and quality of life issues, but it is killing our budget. It's July, and we are just about out of money. We've had so many ambulance calls, fire calls, we're spending so much money on prevention and interdiction that we're just about broke. And we don't know what we're going to do for the rest of the year. So this is that third intersection. That's a fatal flaw for that community, right? We can't, in good faith, recommend a community for that kind of plant that is facing that kind of a challenge. Those of you in the back, I apologize. This is drug overdose mortality rate by county in the United States. This is CDC information, 2014 to 2016. Red is bad. Red are hotspots. The large white areas are counties that are not reporting their data to the CDC. So those are unknowns. White is not necessarily good or bad. We just don't have the data. Now, please do not squint too hard to look at Mississippi. The next slide has the blow up of Mississippi, same data. But I want you to look nationally, where are the hotspots? What have we been reading about? What have we been hearing about, right? The worst in the country. But anyone shout out, what's the worst state in the country for opioids? Ohio and West Virginia, you're right on. It's Southern Ohio. Southern Ohio, that's Cincinnati, the rural areas around Cincinnati, right on the Kentucky border, and West Virginia. West Virginia. The average drug overdose rate for a county in the United States is 20 overdoses per 100,000 overdose deaths. per 100,000 residents. Those areas that are in the red, they're, if I'm reading the scale right, about 87. So about 4 times the US average. On another project that we have, this is a $300 million food project, 350 jobs, looking in the Midwest. Logistics has brought them to the Midwest. We're down to 4 finalist communities. One of our communities is an Ohio community. Perfect site. Made it through all the labor market interviews. Utilities checked out. Community's hungry, wants the project. Great tax regime, good logistics solution. 4 times the US average opioid overdose rate, according to this. That's in our report. That goes to the CEO of the company. That may kill that community. Everything else is great about that community, except that. How about Mississippi? Here's the blow up. I wish more counties in Mississippi were reporting their data, but look on the right. This is good news for you all, at least for right now. Mississippi's average drug overdose rate by county is 15. So you're about 25% below US average in terms of overdose mortality. So either we have a little bit fewer folks that are succumbing to this opioid crisis, or they're not dying from ODs, or both. Not sure, but this is a good thing for you. Your neighbors, Tennessee's really struggling. It's at 25. So they're about 25% above US average in terms of drug overdose. They've got more counties reporting. Look at that hotspot in Louisiana. I'd be worried about that. I don't think a drug epidemic pays much attention to state political boundaries, do you? I don't. I'd be worried about those counties down there. The 10 highest drug-related death rates by county were in Tennessee. Mississippi's highest, Tishmunga at 29 per 100,000, Pearl River at 25, and Tate County at 24. Jackson and Jackson's surrounding area is right at US average. So this is kind of a look, I hate to say that there's no good news with this opioid crisis, right? Okay, let's accept that. This is an awful thing. Mississippi is doing a little bit better than neighbors at fighting this off, according to these statistics. But the caution is watch out, right? I don't know if Mississippi is on the uphill climb and these drug ODs are increasing, or if it's managed and it's on the downhill. We do know that there are examples of states out there that have been successful at fighting this off. Addiction rates, overdose, arrests, Narcan uses, and I'll show you some more statistics here in a second, in some of the Northeast states, like Massachusetts, Pennsylvania, and Connecticut, are actually declining. Those states have put out an all-out press. I think that they're a few years ahead of some of our other states in terms of experience and what works and what they can do to stop it. So if we were to look at an example, I would definitely point your teams towards those states to look at what they've done. Prescription rates. We've double and triple and quadruple checked this number many times because quite frankly, we couldn't believe it. The US average county rate of prescriptions is 76 prescriptions for every 100 people. Think about that. That's every man, woman, child, retiree. That's counted in that number. 76 prescriptions per year per 100 people. That's a lot of prescriptions. That's not pills, that's prescriptions. Again, hotspots. We know that Appalachia and the Southeast are overprescribing, or at least are prescribing a lot more opioids than US average. Again, our blow up for Mississippi and surrounding states. This is just prescription rates now. This is not ODs. Mississippi at 99 99 prescriptions for every 100 people. Let's just call it 1 for 1. For every resident in this state, there's a prescription being written every year. Alabama and Tennessee have 7 of the 10 most highly prescribed counties. Mississippi's highest prescribed county was DeSoto County, which is 3rd highest in this 5-state region. That's a hotspot for you. Why is that happening? What's going on up there? Last chart. This is Narcan. Forgive me for using the trade name for it. I can't pronounce the Naxolone. I'm sorry. Thank you. Naloxone. In fact, it's misspelled on this slide. I sent an updated version of this, and I'm sorry. So it's Naloxone. Apologize for that. These are your Narcan administrations and reported drug-related arrests. Another data point that we have. Left side is Narcan administrations. So either Narcan is being more widely distributed and used by EMS in these counties, or again, we've got an increasing rate of OD to watch out for. I'd want to dig deeper on that. And then drug-related arrests in that county south of Memphis, some of our Gulf Coast counties. Is that because of greater usage, or is that because of greater enforcement? Taken all together, the site selector needs to look at all this data and make those judgments. The site selector needs to interview employers. The site selector needs to understand how important is it to the client themselves. Most clients care about this. But this is bubbling up to the consciousness now of the boardroom. It's bubbling up to our national consciousness as 72,000 deaths in 2017. By the way, that's 10% increase over 2016. We have not hit the peak yet. It's likely to get worse. Our communities and healthcare professionals need to find ways to interdict this and do something about it. That's my last slide. We've got a few minutes for questions. What I would leave with you is, this is something that I think that we can do something about. This is something that I think first starts with awareness. Where are our hotspots in Mississippi? Why are they hotspots? What can we do to help communities that are struggling? And most importantly, I think, how can we build this linkage between healthcare and economic development? You all need to team up to confront issues just like this. Let me please hold on any applause, and let's go right to questions before we run out of time. Yes, ma'am.
What about legalized marijuana? Is that a big impact on your site selection?
Yeah, the question is, how about legalized marijuana? Is that an impact on site selection? It varies company to company. We have companies that run the gamut from extremely conservative to extremely liberal to apolitical in between. I can tell you from an economic performance perspective, a place like Denver, I'm not going to say it's because of marijuana legalization, but Denver has experienced a massive resurgence, especially of young people. I don't know if anybody's visited Denver recently or done any business in Denver or been there. There are hundreds, if not thousands, and you speak to the employer, of young people, millennials, the tattooed, pierced IT worker that makes 150 grand a year, coding things that none of us know how to do. They're going to Denver. And I don't necessarily think it's all about the marijuana, but it's something. So you can't argue with results. We do have clients that are very conservative and have asked us to eliminate any state that has legalized marijuana from the search right off the bat. And we have other clients that say, it doesn't matter to us, we don't care. We're drug testing. Other questions?
Darin, do you have any healthcare-related clients that are looking to expand in their industry?
Governor's question, do we have many healthcare clients that are looking to expand? What we do have, Governor, is clients in the life sciences domain. So med device, biotech, pharma, always a hot industry for us, and is something that we specialize in. Some of those companies are looking for manufacturing sites. Some of them are looking for R&D. And what's important to those companies is linkages with research institutions with a med school. So that's a key criteria for those companies. Yes, ma'am.
So I was introduced to a book recently, Poverty in the Midst of Healthcare Reform, which asserts that about 30% of healthcare costs are in fact social problems that don't get diagnosed at the low level. The homeless into the ER when COVID has been committed, for example. Do you have a way of factoring that in? And what is your observation about how that tracks in our region?
Yeah, so the question is about how do we look at social problems that are consuming so much of healthcare budgets, right? And a lot of these are poverty-driven social issues that may be prevented. And is that a factor in site selection? So, those kinds of factors do show up in statistics, and those kind of factors show up in our quality of life statistics. Part of the quality of life evaluation is to look at health outcomes, the health of the population. Some of that is looking at poverty rate, some of that is looking at educational attainment. There's a whole host of these quality of life statistics that we do use. I can tell you when we did the Yokohama project that ended up in West Point, one of the factors that we looked at was the quality of the local healthcare system. So trauma care, acute care, how many beds were there per capita. We had to worry about if there's an industrial accident, are our employees going to be well taken care of? So that's certainly something that we look at. Aside from that, how Mississippi performs against those kinds of factors, your second part of your question, I don't have data to show on that today, but I do think it's certainly something that's in the process as it relates to quality of life issues, absolutely. Yes, ma'am. Yeah, items that Mississippi can do to make itself more competitive in the healthcare arena. So, anything that Mississippi can do to improve the population health. It goes hand in hand with education, right? So, fixing schools and enabling schools is one of the core ways you can build foundational success for economic development, and the same goes for population health. Anything that Mississippi healthcare, Mississippi economic development can do to improve preventative, expand preventative care, and reduce ER visits, and take those population health steps, I would view that as a positive. Second, this nursing shortage, which was mentioned earlier, is a big deal. And there will be winners and losers nationally in terms of the nursing shortage. It's very interesting to see what other states are doing to attract nurses, to graduate more nurses, to retain those nurses who graduate, and attract nurses from out of state to work in state. We are seeing incentive programs geared towards individuals to get them to move in state with nursing degrees. That's happening. You remember no one remembers, sorry, 1890s, right? Clearly I've been on stage too long. So in the 1890s, right, they give away free land, come to Oklahoma, get a section of land kind of thing. That's happening again. Reduced cost tuition, $10,000 housing allowance, property tax abatement for individuals. This is all happening to try to attract especially healthcare workers. We are in the another 10 or 15 year cycle here of a shortage of medical workers, and I think that's another thing that Mississippi can do to improve its outcomes. Yes, sir. Last question.
Who is tracking the physicians that are writing prescriptions? There is no one like this.
Who is tracking the physicians that are overprescribing, and if there is no one tracking them, why not? Great question for a more qualified respondent than myself, but I'll give you my own personal view. I think that this was just not on the radar screen for a number of years. I think that the opioid crisis, in my personal view, from everything that I've read, and I've read a lot because I care about this particular issue, you have good actors out there, medical professionals trying to do the right thing, that perhaps were prescribing addictive painkillers to populations that didn't necessarily need that level of treatment. I think that's one problem. And then I think there's, of course, these bad actors out there that were overprescribing and doing so illegally in exchange for money and other things, right? And so why wasn't anyone watching the store on that? The suppliers of the opioids, the distributors, the big, and I won't mention the company names, but there's 3 or 4 major distributors that kept, delivering hundreds and thousands of pills to a village doctor in a community of only 600 people, right? We all saw that on 60 Minutes. Why does that happen? And who's not watching that happen? I think there's an awareness now to stop that, whether it's the provider or payer or distributor or regulator, but all of us, all of those actors have a responsibility to prevent this from happening again, and I hope that they do. Thank you very much.